So I thought it'd be great if maybe we start a little bit about just you and your background and the work you're doing for Experian Health.
Yeah, so actually, my background is in retail management and marketing, and I like to tell people I kind of started my career working in retail, but before there were allocation systems. So the true data nerd that I am, I used to sit and run queries off of a mainframe, pull down into Excel, and figure out how to allocate goods across a major retail store. So my love for data kind of grew at an early stage, and I wanted to do more with that. And so as I later went on to get my MBA at Arizona State, Experian came to campus to talk about a leadership development program that they had and all the different ways in which they use data for good and for solving unique challenges across industries. And I was immediately drawn in. And blink of an eye, 10 years later, here I am, still working at Experian. I've evolved through different roles, but now focusing in our healthcare business and have been for the last about 7 years, and really focusing on how we take data and solutions from other Experian businesses and use those to create tools and solutions for the healthcare industry to solve challenges in a different way. So get to work across all of our Experian business units, get to understand our true data assets across North America, and find unique ways to solve for healthcare challenges.
And I think a lot of people listening in are probably like, "What? Experian has a health division? Like, what? Can you talk about like what Experian is doing in the health space?"
Yeah, sure. So Experian actually entered the healthcare space about 15 plus years ago. We started with an acquisition and have since then acquired several companies. And our footprint really spans a few key areas. So we talk about, revenue cycle management. And these are, think of this as when you go to the doctor and they check your insurance to see what services you're covered for, or how much you're going to pay, or whether or not you're going to need a payment plan. Those are the types of things that we provide around a traditional revenue cycle service. We also have tools that are more around patient engagement. So how are we going to engage you? What options of service for payments, and how are we going to outreach to you? And even into things more recently through an acquisition of how do you engage a patient to schedule an appointment? We also have tools around identity management, right? Probably familiar to most of our listeners, that span things around identity resolution. Do I have the right patient? And is this patient who they say they are? So we provide tools around helping hospitals better manage those identities and really that data that's flowing through their system. And then we also have kind of what we call care management. And that's really about how do you help different types of healthcare organizations kind of coordinate care for an individual when they're interacting with different types of healthcare facilities, and having different experiences. But the care plan and the overall health still needs to be kind of managed across these. So what are the tools that help provide that visibility? And really, in Experian words, manage risk. It's healthcare risk, but manage risk appropriately for that patient.
Fantastic. And how is Experian Health using data to alleviate some of the problems that are going on with the pandemic?
Yeah, Experian Health has played a pretty significant role for the healthcare industry during the pandemic. When the pandemic first hit, there was a big kind of reaction, or kind of, I would say, reaction to, we're now testing for COVID. We're now having to bill for the COVID vaccine operationally within a healthcare system. That's, how do I get reimbursed for that? Even though there's not a charge to the patient, how does that healthcare facility get reimbursed? And so helping to manage, again, kind of the coverage, that reimbursement, that's all the cash flow back into the healthcare systems. That's really critical. The other way we played a really critical role was, early on, it was contact tracing challenges, right? A patient is showing up in a parking lot, giving their name and date of birth, and then the results are coming in, and how do you contact that patient? We were helping to service actually a lot of our state level health departments in filling in gaps in critical patient information to help them perform adequate contact tracing to see how the virus was moving. We're still providing that service. We have, I think, close to 25 different state health departments who are still leveraging our services. And continuing that through to healthcare systems themselves. And again, making sure they're reaching out and have the best contact information for individuals. And then even more recently, I mentioned the scheduling, our ability to help in managing the scheduling process. I'm sure people read the news and saw the news reports about the many challenges that were coming up in patients' ability to schedule appointments, both for testing and for vaccines. Using our scheduling platform, the managing of the providers and the schedules and the intervals, we've been providing those tools to many significant enterprise level healthcare organizations to be able to put that service in consumers' hands in a very non-frustrating way. And then, kind of rounding that out, the other area that we've really helped in from a data perspective is around social determinants of health. And for those unfamiliar, social determinants of health is basically a way of saying, your health is determined by more than just, your clinical factors. So whether or not you have diabetes isn't the only kind of reason for whether or not you will be healthy or not. It's really about your environment, your socioeconomic factors that can impact your healthcare outcomes. So that means, are you going to show up for your follow-up appointment, or, if you're diabetic, to get your insulin regularly? Do you have someone at home who's helping keep you on your care plan? And so we've been using social determinants of health to help healthcare organizations identify their high-risk populations, maybe those who don't have access to the COVID vaccine because they lack transportation or they lack the financial means to even afford transportation to go and receive that. And so again, using our extensive data assets across Experian, social determinants of health is a phenomenal story about a one Experian, using our consumer view data, using our automotive data, leveraging our detailed analytics and expertise from, both within health and our decision analytics team and our healthcare team. And I'm sure there's other BUs I'm forgetting, but it really is how we've pulled data and insights and expertise together from across almost every single business unit to drive a really unique solution into market that has a fantastic social impact.
Yes, certainly. It looks like Experian has been extremely valuable and useful for so many industries, especially in healthcare. And it's fantastic that our listeners are learning more about that now. I would like to know if Experian's COVID data has been used so that people can be aware of how many, COVID cases are around. Has Experian been a primary resource to getting that data?
Yeah, we actually have been. So, early into the pandemic, Experian, raised our hand and said, U.S. government, how can we help, right? What can we be doing? We do sit on this data, and we put our best minds together, again, collaboration across multiple business units, our data lab teams, and we came up with what we called the COVID Outlook and Response Evaluator, or the CORE heat map. And that heat map was really designed to take information about what are the demographic indicators, right? So we know that COVID was more impacting, individuals over the age of 65. We know that the social economic factors, right? If you live in a kind of highly populated housing situation, right? The ability for the virus to spread is higher. We took in all of that information plus information about the statistics of the number of cases that were being submitted, the deaths, and we put together a heat map that actually was used to predict individuals with the kind of highest risk of contracting a severe case of COVID. And the intention was to not only kind of help predict the areas that would have to be kind of, or could be the hardest hit across the country down to a county level, but also help in our healthcare organizations to say, if you're going to have, at a time there were limited number of ventilator resources. If you only have, 1,000 ventilators to distribute across your county or across your state, where are the areas you should kind of send them to first to be able to say maximum utilization of where you might get hit hardest by the pandemic. So again, we made that tool available to government and healthcare entities at no charge just an attempt to help our country really address the virus in a more proactive manner.
Fantastic. And I know that a big part of your role at Experian Health is finding new ways to leverage experience data for the healthcare industry. And I would like to know, what is your inspiration for finding new ways to use experience data?
I like to work smarter, not harder. We have such a vast array of data and capabilities and expertise. And, when I started at Experian, I worked on our credit side. And what I realized as I moved into our healthcare division several years ago was, the challenge in front of you might be different, but the way you can approach that challenge may be similar. And so there's commonalities in terms of, regulation. Like regulation, Experian has made a fantastic kind of business out of looking at regulations and finding the opportunity instead of looking at a regulation and finding kind of the detriment or the barrier. And so there is a lot of commonality and similarity across businesses, and the types of challenges that our industries face are really not all that different. I talk a lot about the healthcare industry, and we often liken it to the banking industry and where it was 20 years ago. So prior to having the ability to pick up your smartphone and, go online to do mobile banking and, see your balances and all of that information at your fingertips, banking was a different world prior to that, but they went through that transformation. Healthcare, we're in a similar type of journey where we're at that stage where the digitalization and the digitization of the data that's being passed about an individual is now, it's fully kind of migrating, but the harnessing of the power of that data, bringing together the tools to maybe put it in an app for consumers or allow consumers to interact more personally with that data, we're just on the cusp of that. And so we're taking all the best practices that we can from other industries, the challenges they face, the way they've approached things, and we're looking at how we utilize that within the healthcare industry. So I think there's a lot of kind of lessons learned and best practices to be kind of shared across. And sometimes it's just looking for that advice as to how to approach things. Sometimes it's thinking about, unique uses of data for a similar use case, or it's harnessing, the expertise that sits in our business to just approach a problem analytically and think about it differently.
I'm curious about what excites you about the future of health data? Because you were just mentioning, on our smart devices, we have exercising apps, we have health apps, we're counting our steps, our bike rides. All this data is being collected. If we do yoga, that data is being collected. And so it's very interesting to see how much of our own fitness data, health data is going into our devices. And as you look at all these things, personally, as you're doing it yourself, and then also noticing what Experian's collecting, what excites you about the future of how this health data can help consumers?
Oh, there's so many things. Today, the data in a healthcare environment remains largely separated. And so even though you as a consumer are, getting that information maybe from a Fitbit or an app that you have, that data isn't making its way back into your practitioner, right? Your practitioner is not seeing if you have an elevated heart rate or if you're not, sleeping well, maybe you have sleep apnea. It's not all coming together. And what that means is, the care plan that's being tailored for you is only getting a partial picture. And so what excites me about the future is, healthcare entities are now much more open to the concept of considering these alternative data sources than they ever once were. It used to be, I'm going to make a care decision based on the chart that's in front of me, the past visit information, the vital signs that I just took 5 minutes ago, and I'm going to, build a care plan or a treatment plan for this patient. now the healthcare industry is recognizing the potential that this data unlocks, and data that could not only come from biometrics, right? Those sources, those Fitbits that give you insight into the day-to-day, but also places like Experian, right? That socioeconomic data, right? 80% of the reason why a person stays healthy or not is from non-clinical factors. That's hugely compelling. That is eye-opening for a healthcare industry that has for so long relied on a traditional data set. And so things like that really excite me because, one, as Experian, we sit on a wealth of this different types of data, but we're also really good at bringing all that data together and making sure that the quality of that data is high quality and accurate, and that we know how to tie that data together, right? So making sure that that single view of an individual is consistent, is accurate, it's tied together appropriately. I mean, these are areas where Experian shines across all other industries. And so, thinking about our role that we have to play, we can be such a catalyst for change for the healthcare industry as an entity, as a trusted entity, to be able to bring together this data, but in a way that doesn't overwhelm or crush a healthcare system that still needs to manage their day-to-day operations. We can manage the analytics, harness the power of that, and feed that into their systems to make it seamless so that it's at their fingertips when they need to make that really critical care decision.
That's fantastic. And you mentioned early on that we're helping hospitals and healthcare organizations with patient engagement. And I know that's like a huge pain point. In fact, even today, I was trying to contact my doctor for my daughter, and I was on the phone for like 30 minutes just waiting, and I kept getting the same kind of loop voice recordings going over and over again, just waiting, because it's so hard sometimes to see a doctor, especially in the midst of a pandemic. And I'm curious about, like, because it's such a huge pain point, can you talk about like some of the solutions or things we're doing and offering healthcare organizations around that?
Yeah, there's several different things. And, I think a trend that was on the rise even prior to the pandemic, but accelerated even further through the pandemic, was patients accessing healthcare services remotely. And so, as you think about the way that a patient's now interacting with healthcare, they're interacting through their mobile device or their laptop. You're doing telehealth visits, you're, getting your appointment scheduled through your phone. Experian Health actually has what we call kind of a consumer digital experience solution bundle that allows an individual to not only be able to go online, schedule that appointment, receive those appointment reminders, but also be able to fill out that paperwork. So a huge pain point in healthcare is going into that doctor's office, getting that stack of paper that says, hey, fill out all of this information you filled out 15 times before and spend 30 minutes on it, and you won't get seen by your doctor until it's completed. We're not pulling that up front in the process, right? So avoid the pain, avoid the conflict and the friction of when you're in that doctor's office or in that hospital, and say, hey, you can do your scheduling of your appointment. You can go online or go on your mobile device, and you can also fill out that paperwork via a mobile device. And you can also maybe make a co-payment, right? All of those things, so that when you show up to receive care, that experience is so much faster and so much less tension filled, because you've been able to do it at your own convenience from in your home or being out in public. It's all making it accessible at the fingertips of a patient. Things like that are really transforming kind of that patient experience. And again, I liken it to other industries. It's putting the information at the fingertips of an individual. There aren't many other industries where people would, stand for, well, I'm not going to tell you how much this costs, and I'm not going to give you any of the information until you show up. It's like you wouldn't go and buy a car without knowing how much it was going to cost. And so in healthcare, I think solutions like this are really transformative and really are taking that patient engagement strategy to the next level. And when you think about how we're engaging with patients, you can also layer on top and think about, services from our targeting business. If you can help healthcare organizations understand this consumer responds best via text. This consumer is going to respond best via, email. The engagement strategies, the channels you use can be optimized to your client, your patient base for your clients, so that their kind of outreach efforts are optimized, and they're also interacting with patients in the way they want to be interacted with. Again, it just takes that engagement level, which is good, to that next level of making it tailored and customized to a patient's needs. And there are several others, but that's I think one of the most transformative for healthcare, and one that most people can relate to say, I've got a screaming sick child sitting in my lap and I'm filling out a stack of paperwork, like, help me, right?
100%.
Mom of two, I've certainly encountered that.
Oh, totally.
Yeah, exactly. Oh my gosh. Yeah, that's really exciting to hear that, about how Experian's so involved in that. And how about identity services? Because that's also like a huge pain point for organizations to verify who they're chatting with. And then that person wants to be able to verify themselves in an easy way.
Yeah, there's a lot of transformation going on. And actually, I neglected to mention this earlier, but Experian Health has played a significant role even throughout the pandemic, but particularly during this vaccination process, where our identity proofing tools are integrated with some of the largest healthcare software vendors, Epic being one of those, but we have several others, where we've been that main access kind of filter to make sure that it's very sensitive health information that you're providing someone access to. And it's very critical to ensure that you put that information in the right hands. And so leveraging our decision analytics business, right, our Precise ID solution has played a phenomenal role in aiding that process. And it's not only maintaining that security, but also providing convenience for the patient. So again, traditionally in healthcare, it would have been you're showing up at the doctor, they're giving you a paper code, you're going home, you're entering that in, you're getting an email. It's a whole long drawn out process where, Precise ID gets integrated with the healthcare software, and a patient can go online. They can access that patient portal that holds all of their information, their test results. They can view their medical record. They can interact with their doctor in a whole different way. And so we've been kind of on the forefront of providing those types of services, I'd say vastly across the healthcare industry. And again, it's kind of that perfect balance of significant patient benefit. There's the convenience factor, and that engagement goes up, but also it's the security, right? The peace of mind for the health system that information is being protected. And we're continuing to kind of layer tools on top of that to help, again, facilitate those main areas.
That's super helpful. Well, I know we're up at our time, but Karly, I wanted to ask you before we go, if you could send a message, or if you're talking to healthcare organizations or hospitals, what would you want them to know about the ways that Experian can help them?
I think there's a lot of energy right now in the healthcare industry that's going towards focusing on the digital front door strategy. And I think when we talk about that in healthcare, it's everything from the patient engagement and thinking about how you want to interact with your patients, the way you want to interact with them, where and how you want to interact with them. But it's also about thinking about the security of that information, how you're protecting that information. I would say, hey, Experian is a great partner, a great ally to help you in formulating what that strategy is and building out and thinking about the possibilities, not just for your near-term strategy, but what does that look like long-term, and how do you tackle some unique challenges, the challenges you haven't even thought about. Very similar to when healthcare was first evolving from paper-based records to electronic records. The industry wasn't really aware of what the challenges ahead were. They didn't know that there was going to be the challenge in trying to coordinate that information. And so, as organizations in healthcare really start to think about that digital front door strategy, I say think about your partnership with Experian. We'll help you think about that strategy, think about the tools, think about those challenges, because again, We're experienced. We've seen those challenges play out in other industries. We're experts in how to manage that data, and we're experts in utilizing that data to kind of unlock new opportunities and harness it for the future. That would be my advice. I might be slightly biased, but...
Amazing.
I love that. That was fantastic. That was so good. Well, Karly, thank you so much for being on the show.
No, thank you again for having me. I really appreciate your time today.
Thank you so much for listening to this episode of the Data Talk podcast. We share new shows every week, and you can find the full catalog of previous episodes, including YouTube videos, on our Experian news blog. You can get access to the full catalog by going to experian.com/datatalk. And we always love hearing from our community, so if you have any comments or suggestions for future shows or guests you'd like to hear from, please let us know. You can leave a comment on iTunes, or you can reach out to us on Twitter at Experian Data Lab. You can also email me directly. My email is michael.delgado@experian.com. Take care, and we'll chat next week.